Mandatory vaccine policies, booster shots, and of course, surging cases of the Delta variant. Here to help us make sense of it all is epidemiologist Raywat Deonandan, joining us from Ottawa. Hi, Raywat, how are you?
I'm fine. How are you?
Good, thanks. So case numbers in Ontario increased above 600 today. We've seen a steady, I guess, spike in the case counts, 500 pretty much for the better part of the week. How should we feel about seeing this consistent rise in infections?
We should be concerned. It's not looking good, to be honest. The modeling is troubling. We're looking at a pretty high attack rate, especially amongst the unvaccinated youth in the fall. Remember, this is a pandemic amongst unvaccinated young people. That's what we're looking at.
And we're seeing vaccine mandates being implemented in various sectors, including most recently public service employees in Ontario. So from your perspective, do you think this is the difference that will make the difference in avoiding another lockdown?
It's going to help for sure. The more we can do to encourage uptake of vaccines, the better. It's our obvious way forward. It's not going to hurt, that's for sure. Certain professions absolutely have to be vaccinated. Forward-facing professions like healthcare workers, first responders, teachers, those kinds of things. So yeah, we have to deploy every tool possible to cajole and incentivize vaccination.
Okay, so the CDC published, I think, several reports this week, obviously concluding that while the vaccines do reduce the likelihood of severe outcomes of the virus, the shot's protection against COVID does decrease over time. So how effective are vaccines months after receiving them? And do you think we will need booster shots to maintain that immunity?
We're going to need booster shots eventually, I think, but probably not till next year. And frankly, the American situation is not the same as our situation. One of the confounders is the interdose interval, the time between the first dose and the second dose. Here in Canada, our interdose interval was much longer, which means we probably have longer and more stable, durable immunity. So we won't need a third booster for some time. Additionally, we should care about the rest of the world. We should focus on people who haven't got first or second shots yet. That's how we get sufficient community immunity to stop this thing in its tracks. So before we start talking about third doses, we should talk about first and second doses.
Okay, well, that answers my question. I was going to say, are booster shots premature at this point? If variants can still develop and spread from other countries that have limited access to even a first dose.
That's exactly right. We have to stop the variant farming in its tracks. So that means vaccinating the large populated centers of the world to prevent people from becoming infected in the first place.
So let's talk about the children now. Is the Delta variant, I wonder, just again, from what I'm seeing in the States, hearing, ICUs without any pediatric beds left, is this variant having a more serious impact on kids because of the nature of the variant and the virus, or is it simply just because kids under 12 can't get vaccinated?
Well, it's a complicated question, and we don't really know for sure. What we know for sure is that Delta is hyper-transmissible. So the increase in the number of children in the ICU beds might be because more kids are getting it, therefore more kids are getting sick. The proportion of kids getting sick might be the same. It's unclear. So about 1% of infected kids end up in the hospital in the USA, and a third of those end up in the ICU. So a tiny percentage of a large number is a large number. So more research is needed, but definitely kids are not magical unicorns. They can and will get sick.
Now, I know there's growing unsympathy for those who are unvaccinated, but there are people who legitimately cannot get vaccinated for medical reasons. So what's your guidance to them about how they should navigate this fourth wave? Are they just relegated to isolation until COVID disappears?
No, we have to take care of those people. It's not their fault, and I really feel for them. So people who cannot get vaccinated have to take extra precautions, wear high-quality N95 respirator masks, especially if they're going to be indoors because COVID is airborne, and make sure the people around them are vaccinated. The way we protect those who cannot protect themselves is we must protect them. And that means each of us must submit to vaccination. That's how we protect everybody else.
Okay, great advice and great insight as always. Once again, folks, that's epidemiologist Raywat Deonandan in Ottawa. Thanks again.
Thank you.